Hi everyone, and welcome to Group 2's presentation on refugee healthcare and the government's position by Kylie, Megan, Stephanie, Tess, Amanda, Carolyn, Jessica, Cecilia, and Carmen. This is for Unit 2, Canadian Healthcare. So some of the questions we are going to focus on for this presentation are: how is the Trudeau government's stance on refugee healthcare different from the Harper government? Did the Harper government's values coincide with the Canada Health Act? And do the Trudeau government's values coincide with the Canada Health Act?
What is a refugee? A refugee is someone who has either resettled from abroad or has been allowed protection in Canada. There are three types of refugees. A refugee is someone whose claim has been processed and granted refugee status. A claimant is someone who is in the process of making a claim for refugee status in Canada, and this claim may be made from within or outside Canada. A protected person is someone who faces risk of torture, cruel or unusual punishment, or death if they return to their home country. What is Canada's role with refugees? Refugees in Canada are able to start new lives. Refugees that either come to Canada or are already in Canada are part of Canada's refugee system. Within the system, they are a part of either one of two programs. The two programs are the Refugee and Humanitarian Resettlement Program and the In Canada Asylum Program. In the Refugee and Humanitarian Resettlement Program, refugees are identified by Canada and the United Nations High Commissioner for Refugees and others to identify refugees who are in need of resettlement. Many of these refugees are forced from their homes due to unimaginable circumstances and may have been forced to live in refugee camps for numerous years. Once a refugee is selected, it takes a while for their claim to be processed. During their claim process, they are screened for issues related to security, criminality, and health. In Canada Asylum Program. This is a program for those who are within Canada and are making a refugee protection claim. These refugees have a real fear of returning to their previous country due to chance of punishment or torture. In 2014, over 13,500 people had come to Canada and made a claim within the asylum program. The screening process for this program is similar to the Refugee and Humanitarian Program and involves security, criminality, and health. Assistance for refugees who resettled into Canada. Refugees who need to be resettled will receive initial assistance from either the federal government, the province of Quebec, or private sponsors. The refugees that are selected under the Government-Assisted Refugees Program will immediately receive services and financial support under another program called the Resettlement Assistance Program, or RAP. The financial support or income will usually be provided for up to 1 year or until they become self-sufficient financially. RAP is provided for shelter, food, and incidentals and depends on which province or territory the refugees resides in. When a person or family first arrives in Canada, they are assisted financially through the RAP program for the initial expenses that they will endure. In 2013, Canada launched a third program for refugees coming to Canada called the Blended Visa Office Referred Program. This program matches a refugee with a private sponsor within Canada. These private sponsors provide financial and also emotional support for refugees for the duration of the sponsorship period or until the refugee becomes financially independent. This usually lasts about 1 year, but can also extend up to 3 years. These sponsors also assist with housing, clothing, and food. There is a variety of assistance and services that is provided to all newcomers that helps them adjust to their new life in Canada.
Now we will talk about the Canada Health Act. In order to understand if the governments are fulfilling the requirements of the Canadian Health Act, We will review the key principles of that act. So what is Canada's Health Act? The Canadian Health Act is a federal legislation that was passed by Parliament in 1984. The Act provides conditions and criteria by which individual provinces and territories in Canada must follow in order to receive federal funding for healthcare services. It also contains provisions that ban extra billing and user charges. The aim of the Act is to ensure that all residents of Canada have access to necessary hospital and physician services on a prepaid basis without any financial or other barriers. So there are 5 principles of the Canada Health Act that outline the conditions that the provinces and territories must follow in order to receive federal funding. They include comprehensiveness, universality, portability, accessibility, and public administration. So comprehensiveness means that all provincial and territorial plans must ensure all medical services provided by hospitals, medical practitioners, and dentists working within a hospital setting. Universality means that the health insurance plan of a province must entitle every single insured person in the province to the insured health services provided by the plan on the same terms and conditions. Portability means that the health insurance plan of a province must not impose any minimum period of residence in the province or waiting periods longer than 3 months before residents of the province are eligible to insured health services. The health insurance plan must also provide for and be administered in a way that provides payments for any costs of insured health services that were provided to an insured person while temporarily away from province. It is important to note that there are some limits of coverage when outside of Canada. Accessibility means that all insured persons have reasonable access to healthcare facilities. In addition, all physicians, hospitals, and so on must be provided reasonable compensation for the services they provide. And lastly, public administration. This means that the healthcare insurance plan of a province must be administered and operated on a non-profit basis by a public health authority appointed or designated by the government of the province.
Last year marked a big change in healthcare coverage for refugees. We elected a new Canadian federal government. We went from having a conservative party to a liberal party. The two parties had very different views on how to approach medical coverage for refugees. This was a big topic in the debates throughout the 2015 elections. In 2012, the Harper government made changes to the program that determined what kind of health care the refugees received. During the 2015 election, the Conservative government was scrutinized by the Liberal government for making those reductions in the IFH program. Harper's stance was that he did not believe the Canadian government should offer refugees a better health care plan than the ordinary Canadian can receive.
What is the Interim Federal Health Program, or the IFHP? So the IFHP provides limited and temporary health care coverage for protected persons, refugee claimants, and other groups who are not eligible for territorial and provincial health insurance. This plan does not cover healthcare costs, which would be covered under public and private health insurance plans, and as well does not coordinate with insurance plans for services such as co-payments. There are 4 categories of healthcare services: basic coverage, supplemental coverage, prescription drugs, and immigration medical exam. These essential health services are similar to the existing social assistance programs in Canada. So basic health coverage covers hospital visits or services for medical providers such as doctors or nurses, as well as labs, diagnostics, and ambulance fees. Supplemental coverage includes vision and urgent dental care, home care and long-term care, allied health services such as physiotherapy, occupational therapy, and speech therapies, and lastly, medical and assistive devices or equipment. For prescription drugs, the coverage is similar to the territorial and provincial drug plans. For immigration medical exam, or the IME, permanent resident applicants, temporary residents, and refugees are required to complete this exam. The exam includes physical and mental examination, health history, labs and diagnostics, and a medical assessment and review. Harper government's impact on refugee healthcare policies. On June 30th, 2012, Stephen Harper implemented changes to the IFHP. Prior to the reform, all refugees and protected persons, regardless of status, received essential healthcare services once arriving in Canada. Under the new reformed policy, refugee claimants now had to wait at least 3 months before they would receive healthcare coverage. Also under the new plan, refugees were categorized into different levels of healthcare based on their refugee status. If you're interested in learning more about the categorizations of healthcare services in relation to the refugee status, you can take a look at an article by Stephen Barnes called The Real Cost of Cutting the Interim Federal Health Program. If you're also interested in the current benefits that are covered by the IFH program, you can take a look at the Government of Canada's website under the IFHP benefit grid. Stephen Harper's new policy changes eliminated healthcare coverage for refugee and refugee claimants, as well as reduced healthcare services for all protected groups and refugees. Jason Kenney, the former Citizenship, Immigration, and Multiculturalism Minister, has stated that these changes to the IFHP would balance healthcare costs across the categories. So if a refugee had come from a safe country, they would not get full health coverage in Canada because those refugees are more likely to have better health care services from their country of origin, whereas those refugees who are from unsafe countries would get more health coverage because it was less likely they had access to essential health services in their country of origin. Harper government's impact on refugee health. As documented by the Canadian Doctors for Refugee Care, the program changes had adverse outcomes on refugee health as a result of the inequitable access to health services. Lack of access to primary and preventative care services would result in exacerbation of conditions leading to more urgent care needs. However, families and individuals may forego emergency care services because without medical coverage, they are required to pay for all services in full. As a disadvantaged population, they may not be able to pay for these services, resulting in significant medical bills. Denial of coverage due to administrative errors and poor communication regarding the program's policy changes had significant impacts on the refugee population. In the 2012 Health Equity Impact Assessment, reduction of services in the new IFHP would greatly impact certain populations. They identified women and children, as well as vulnerable or disadvantaged populations, having the greatest negative impact. An example given in the impact assessment was a woman claimant arrived into Canada pregnant, but would not be able to get adequate testing to monitor her pregnancy as she awaited for her IFHP program coverage to be implemented. So as a reminder, under the new Harper government policy, there was a wait period of 3 months as a refugee claimant before coverage was implemented. The program created a system of confusion and administrative complexity. Refugees were being denied care until coverage could be proven valid, and in some cases were still denied due to poor communication of policy changes. An example being a child with a potentially contagious rash was turned away from a clinic because her program coverage, although valid, was not accepted by the clinic. Overall, refugees were suffering from a loss of basic health needs and services. They were experiencing poor quality of care from healthcare providers, inconsistent and inequitable healthcare services, a decreased access to healthcare services, as well as a decrease in overall wellness. On National Day of Action, June 15th of 2015, the Canadian Doctors for Refugee Care took to the streets of Toronto to tell Canadians about the impact of the reformed IFHP program. The video below talks about some of the key points we previously discussed.
We're standing here at the 4th annual Day of Action here in Toronto. We are one of 20 cities that has organized healthcare workers across this country to ask for the federal government to rescind their cuts to refugee health insurance.
The doctors have documented dozens of cases of pregnant women and sick children who are refugee claimants being denied care.
The cuts to the interim federal health program puts our healthcare professions in an untenable position, forcing them to choose who receive treatment based on a complex set of rules.
Since 2012, paperwork gymnastics, multiple phone calls on a daily basis are part of our routine. The rules are barely understood by the people in the system.
The Federal Court of Canada in July 2014 found these cuts unconstitutional, in violation of the Charter of Rights and Freedoms, and described the cuts as, quote, cruel and unusual treatment.
First of all, the government says this is about saving costs. It's not about saving costs. In fact, the best way to ensure that costs rise is by depriving people of the most basic and efficient forms of health care. And when you deprive them of that, they end up where I work in the emergency room with complications that are cruel and are incredibly costly. So this is nothing about cost savings.
The federal government within hours announced it was appealing the Federal Court of Canada decision, brought in a temporary coverage program which did not fully comply with the judge's order. The federal government spent over $1 million, well over $1 million, in legal costs just opposing our actions.
And to be honest, the only conclusion that one can reach is that it's a completely ideological decision. The courts have struck this down. The people of Canada have made it clear that they don't believe that these cuts are appropriate or humane. And it doesn't make any sense that the federal government would be choosing to defend this decision rather than reverse it.
The fact remains that refugee claimants are in our country, and until the federal government determine their status, many refugee claimants, including sick children, pregnant women, will require care. We support a healthcare system that reflects the principles of fairness and compassion and providing health as a right for the people in this province.
We've asked for a meeting with the Minister of Citizenship and Immigration Canada, Chris Alexander, from a few days after he actually obtained the portfolio. We have yet to hear back.
And we know that the federal Conservative government is listening. Last year, the Conservative government monitored the 3rd National Day of Action sponsored by Canadian Doctors for Refugee Care, and our activities were reported to the government's Operations Centre, which is responsible, believe it or not, for threats to national public safety and security.
We've had support from over 20 national health associations in Canada, including the Canadian Medical Association, the Canadian Nurses Association, the Royal College of Physicians and Surgeons of Canada, the College of Family Physicians of Canada.
Unfortunately, this government has been incredibly intransigent, despite hearing the voices of the Canadian healthcare community, Canadian artists, of the courts now, provincial health ministers, all of whom have condemned the cuts. They still are unwavering.
We will not succumb to your conservative rhetoric that these cuts are about saving taxpayers' money. This is a rhetoric, and this is a pernicious and vicious attack against justice-seeking people and refugees in this country.
Listen to healthcare providers, listen to the doctors and the nurses and the social workers and the Canadian citizens, and listen to the federal court who is telling you that this is not a humane way to treat human beings, and this is not something that allows us to be proud of being Canadians.
We will come back, and we will continue coming back to this corner, and as I said, many corners in this city and across this country, to declare that the government's position by cutting health care to refugees and for refugees is a bogus act.
In Barnes' conclusion of the real cost of cutting the interim federal health program, he states, "These negative and inequitable health outcomes are avoidable. Now that the changes to the IFH program have been implemented and the negative results are evident, we again strongly recommend that the federal government reinstate the full IFH program. The evidence is clear. Cuts to the IFH program are contributing to the poor health for refugees and refugee claimants."
Justin Trudeau, throughout the 2015 election, had a strong stance on helping refugees. In a 2015 debate, he said, "They cross the oceans and they make it to Canada, and what does Harper do? He takes away their health care." When Trudeau was elected, bringing over refugees was one of his first actions as a new Prime Minister. Justin Trudeau and John McCallum worked together to bring over 10,000 refugees by the end of January 2016. Their total goal was to bring over 25,000 refugees to help with the Syrian war. With the new party in power, not only did they bring over refugees, but they made some changes to the healthcare system for the refugees. Please see the short video below.
I'm here to announce that the healthcare for refugees will be fully restored to pre-2012 coverage for all beneficiaries as of April the 1st of this year, which is a month and a half from today. And there's another novelty to this announcement. Not only are we restoring all the services that were in existence in 2012, but we're also announcing today that as of April the 1st of next year, April 1st, 2017, the government will expand pre-departure medical services for refugees who are identified for resettlement to Canada. These services will include coverage for immigration medical examinations, certain vaccinations, management of outbreaks in refugee camps, and medical support during travel to Canada. These changes will improve the health outcomes of refugees. They will reduce longer-term health care costs for provinces and territories, and they will help protect the health of all Canadians. Restoration of the interim federal health program, is good news from a public health perspective, from a resettlement perspective, and from an economic perspective, because refugees who were not previously covered would go to emergency centers of hospitals if they were really sick, where the cost was in fact higher than were they to receive health care through the normal channels. So we are pleased to announce that for all of these reasons, and also because it is the right thing to do.
The ongoing Syrian conflict has created the world's largest humanitarian crisis since the Second World War. The Canadian government has taken positive strides to help with the humanitarian crisis. Canada is helping by bringing over the people fleeing their home country. These people, if unable to leave their country, will be left with the choice of being forced to join the militant efforts or be tortured and murdered. In Canada, Trudeau's changes to the IFH program will help the refugees receive health care when it's needed instead of having to wait a 3-month period. The comprehensive coverage, such as dental and prescription, will allow them to spend their first year in Canada becoming a healthier person without being burdened with the health care expenses. Many of these people have PTSD and need to emotionally as well as physically become healthy. Trudeau's changes to the IFH program help this happen with less burden. Under the Harper government and its changes to the IFH program, the registration and reimbursement process was complicated and led to confusion for healthcare providers regarding the extent of coverage for the refugees. These complicated rules of the IFH program led to the healthcare providers not knowing which services could be reimbursed, leading to some providers charging refugees for services they were entitled to, and even worse, the providers denying care to some refugees. Under the Trudeau government, the changes to the IFH program, such as eliminating the categories of the refugees, made it more manageable for the healthcare providers to know which services the refugees were insured for under the program. Although some further strides need to be made to acknowledge how the IFH program works and how it can be accessed, it is suggested that the federal government work with the provincial and national medical association to create an awareness campaign about the IFH program so that the healthcare providers know how it works.
So now we'll talk about how nurses are affected by the changes in the IHF program. So what is the nurse's role in influencing change? Nurses are effective leaders of change. They take part in collective action, meaning they work together to achieve a common goal or objective. They have an understanding of history and structures of the Canadian healthcare system, and they educate both themselves and their patients. What are some things nurses need to know? Nurses need to know and understand the Canadian healthcare systems. They need to know about the programs offered, the structures of it, and the ideologies, both past and present, and take part in evidence-based practice. They have to be aware of the national and international influences and pressures on the healthcare system. They have to know about the quality resources for information, such as public debates, professional associations, education, libraries, and the internet. And they have to be aware of the trade agreement influences, such as healthcare, public health, and professional practice. They have to know about and apply the Code of Ethics, and they have to use professional collective action, autonomy, and self-regulation. To continue a little more with the last slide, we're going to talk more about what nurses need to be and what nurses need to do. So nurses need to be educated, good listeners, and sensitive caregivers. They need to recognize and address marginalized populations, think critically about the influence on healthcare and how we as nurses can influence those who influence healthcare. Value all individuals regardless of their status, power, race, and so on. We need to be a role model, and most importantly, we need to be the change. So what nurses need to do? We must work together to reach goals and objectives for both patients and professionals. Like we talked about before, collective action between nursing organizations and provincial and federal governments. We need to focus on addressing the determinants of health. So this means we must be educated, have nurse-patient relationships, and know that health and well-being are affected by achievement, control, and self-esteem. And lastly, we must realize that relationships with patients allow nurses to see the outcomes of care and is important to communicate to government bodies, such as bureaucrats and politicians. So now that we know more about the criteria of the Canada Health Act, we will conclude by talking about whether or not those criteria were being met by the Harper government. As previously discussed, by implementing the reformed 2012 IFH program, Harper's government placed healthcare restrictions on refugees and protected persons by assigning healthcare services by refugee status and delaying the initiation of their insurance plans. Harper altered the previous IFH program in a way that reduced the quality and equity of the healthcare services for these disadvantaged populations. In conclusion, Harper's changed healthcare plan did not meet all criteria of the Canada Health Act, including comprehensiveness, as a lot of refugees did not have access to necessary healthcare services prior to the implementation of their insurance. Accessibility, as a lot of refugees didn't have access to healthcare facilities or providers that were willing to voluntarily treat them. Public administration, as they didn't have provincial, territorial, or private insurance that assisted them with getting treatment for chronic and preventable conditions. For example, if they were to have diabetes, they were going to have to pay for medications out of pocket. And lastly, universality, as Canadians and refugees do not have equal entitlement to the same levels of care.
To answer whether the Trudeau government is meeting the principles of the Canadian Health Act, we will talk about two of the factors of the Act: comprehensiveness and accessibility. The Liberal government's changes to the IFH program increased comprehensive health care for refugees. The changes allowed health care to be provided while the refugees were transporting to Canada, and immediately once they arrived, opposed to having to wait a 3-month period. The changes also allowed refugees to receive a dental and prescription coverage, which the average Canadian does not receive through federal funding. The Syrian refugees underwent disease screening and mental health screening. With these considerations, the health care that refugees and refugee claimants receive is in fact comprehensive. Shortly after refugees arrive, they are supposed to be assisted with accessing the healthcare system through a service provider program. A service provider will connect the refugees to doctors that are accepting new patients. Although Canada may have the capacity to treat and care for refugees, the logistics seem to be the problem. It would be ideal if there was one major service provider that organized and connected the refugees to doctors and that had the capability to connect healthcare providers working in the hospitals to the patient's assigned doctor in cases of emergencies. Another problem involves language barriers. It has been reported that in some cities there is a shortage of language interpreters. Although there are some logistics that need to be further corrected, for the most part, medical care is accessible to refugees under the IFH program. It is clear that the Trudeau government wants to help refugees by making healthcare accessible and comprehensive. And that concludes our presentation on refugee healthcare and the government's position. We hope you now have an understanding of the IFH program and how it affects our healthcare system. Thanks for watching.